Well, hello and welcome, everyone. My name is Tracy Kajewski-Correa. I am the co-director of the Keough School of Global Affairs Integration Lab, and I'm delighted to welcome you to this year's GPE Showcase. The showcase is held every fall as an opportunity for our teams to come back together to share reflections on their summer experiences with the wider Keough community. Now, due to the restrictions on in-person gatherings, we have pivoted our traditional model of gathering together in the iLab around food and drink and shifted instead to this webinar format. And as we learned this summer with our projects, this is a way to take the challenges that are created by the pandemic and make them into blessings, because now we have the opportunity to reach even more of our friends and colleagues around the world. Today, we will have 6 teams who will take you on a journey around the globe to the sites of their projects with our 5 partner organizations. And as you'll see in today's program, our order of events will be organized into 3 different thematic segments. And each segment will feature a pair of lightning talks, about 5 minutes long, from a pair of teams, with a brief discussion moderated by that team's faculty advisor. And we will reserve time at the end of our program for questions from our guests and for some closing remarks from our iLab co-director, Steve Reifenberg. Now, for the duration of the webinar, we will have the chat and audio features muted for our guests, but we do invite you to use the Q&A feature that you should see on your Zoom panel. You can use this at any time to submit a question to any one of our teams. And as time permits at the end of our discussion and our formal presentation, we will have a Q&A discussion period with all of our teams, and then wrap up and conclude by about 12:30. So with that brief welcome and introduction, I'm now going to actually cue it over to our first segment, Engaging the Private Sector in Addressing Global Challenges. This pair of lightning talks by Chemonics PSEA team and the Corning team will be facilitated by their faculty advisor, Melissa Paulson. Melissa, over to you.
Good morning, everyone, and thank you very much, Tracy. I've been fortunate enough to work with 2 iLab teams on private sector and addressing global challenges. And without further ado, let me introduce our first team, Chemonics PSEA team, which includes Jamie, Shadwa, Uriel, and Lara. And they are asking the question, how can development organizations effectively partner to increase development outcomes? Over to you, Uriel.
Thank you, Melissa. Good day, everyone. We are the Chemonics PSEA team, and we're excited to present about the work we did over the summer. So we've divided our presentation into 4 parts. First, I'm going to talk about the motivation behind our project. Next, Shadwa is going to discuss our methodology. Then Jamie is going to examine our team's response. And finally, Lara is going to outline our team's major learnings. Next slide, please. So one of the most pressing challenges facing the international development community today is the need to expand engagement between the private and international development sectors. By private sector engagement, we mean leveraging market forces and private companies to solve development challenges. As it stands, some development practitioners are hesitant to initiate partnerships with the private sector, either due to preconceived notions about the private sector or because they simply don't know how. This is problematic because the development sector has limited resources, and the challenges the development community confronts today are staggering. For this reason, development practitioners are realizing that it is critical to tap into the private sector and its vast resources and expertise to meet the development challenges of the 21st century. To talk about our methodology, I will now give the floor to Shadwa.
Thank you so much, Uriel. Next slide, please. Even though we were forced to conduct our research remotely, we strive to stick to our evidence-based approach to guide our steps throughout the project. We started off by surveying Chemonics field and home office employees to have a real understanding of the current level of proficiency of private sector engagement within the organization, as well as to identify the bottlenecks of building sustainable partnership with the private sector from their perspective. Secondly, we interviewed key experts on private sector from Chemonics and outside the organization to validate our findings and discuss our potential solutions. Once we had a clear understanding of our deliverables, we engaged with the project teams via conducting interactive workshops using online platforms, as well as conducting in-depth interviews with different stakeholders. Our geographical reach was 42 countries and 28 different projects for the survey, and we worked closely with 4 different projects in 8 countries. One of our interviewees mentioned that in very few cases, the partnership with private sector becomes a real relationship. We aspire to support these development practitioners to create meaningful partnerships via our deliverables, which JB will discuss in the next slide.
Thank you, Shadwa. Perfect. We began to visualize 3 different solutions that ultimately formed our final deliverables: a feasibility study, a private sector engagement white paper, and 7 PSE case studies. To begin with the feasibility study, we partnered with a Chemonics project called Resilient Waters, which aims to build water-secure African communities through improved water management and increased access to safe drinking water. The Resilient Waters team discovered a unique and interesting model called FundiFix that the government of Kenya was using to repair water infrastructure by partnering with local private sector organizations. We're now in the process of completing a study in order to determine if the model can be utilized in Namibia. Our second deliverable is designed to build capacity and spread knowledge throughout the Chemonics organization. Our team has developed a private sector engagement white paper focused on highlighting the various ways that both governments and the development sector can engage the private sector, specifically in the health supply chain context. Within the white paper, we included PSE tools that Chemonics employees can use when operationalizing PSE. Lastly, we discovered that there are many Chemonics projects already employing elements of private sector engagement. Our team wanted to highlight these positive deviants and share the best practices through 7 PSE case studies. We believe that if Chemonics employees see that their colleagues are currently engaging in PSE, they'll be more likely to apply PSE principles within their own projects. I'll now pass it over to Lara to discuss our major takeaways.
Thanks, Jamie. So our first insight revolves around the way development practitioners see the private sector when they work with them. Looking at the private sector as an equal partner is a key incentive to initiate a positive and sustainable engagement. This is reflected by including them early in the planning process and recognizing both their monetary and non-monetary contributions, such as their technical expertise. Our second insight revolves around understanding the needs of the private sector to create opportunities from their challenges. More sustainable engagements will occur when the private and development sectors identify common interests through shared value partnerships where both parties contribute equally. Our third insight revolves on the principle that there's no one-size-fits-all model for successful private sector engagement. However, trust is a cornerstone, and it means that both parties are willing to invest so that the partnership can grow through a multifaceted process. Thank you so much, and and we'll look forward to the Q&A.
Thanks so much, PSEA team, and thanks for your willingness to go first. Our next team, the Corning team, it includes Rachel, Janayam, Chioma, and Tim, and they're exploring how the private sector can impact environmental and societal outcomes. I'll pass it over to Janayam.
Thank you. Good morning. I, Janayam, and my teammates Rachel, Chioma, and Tim partnered with Corning Incorporated to figure out how and where in India their new innovative air purification technology can be used to maximize impact. Part of what is innovative about Corning air purification system, CAPS, is that first, it can purify outdoor air, and second, it targets PM2.5, the deadliest air pollutant. Next slide, please. So the problem is that PM2.5 air pollution is a public health crisis in India. In comparison, what is considered a public health emergency right now, due to wildfire smoke in Portland, Oregon, is the average level of air pollution Delhi gets every November. 1.2 million deaths are attributed to air pollution in 2015, and 3.5 million deaths are predicted in 2050 if nothing changes. Children are the most vulnerable to detrimental and irreversible health effects, ranging from asthma to potential brain development damage. The issue is being addressed. However, it is not enough to effectively solve the issue due to lack of political will, coordination issues, and enforcement mechanisms. Corning air purification system can fill in the gaps of existing agenda to improve air quality. Next slide, please.
So in response to the problems that were outlined by Janaim, we identified some key areas that our team could provide value. So we began by mapping the key stakeholders. So we highlighted the key players from government, civil society, the private sector, and research communities, and we asked how they experience and respond to air pollution. Next, we estimated the market segmentation and size. So who will buy the technology and why, and is this market sustainable? Next, we created a needs assessment to understand how the needs vary by stakeholder, location, and political environment. Then we assessed opportunities and risks. So we outlined possible changes in the political, environmental, economic, and social environments and saw how these changes could impact implementation. And of course, as Keough students, we have the goal of creating a sustainable and socially equitable solution. So we asked, how might we maximize the societal and environmental impact? And lastly, based on all these prior sections, we identified key funding opportunities and feasible pathways to implementation. And on to Tim for methodology. Next slide.
So obviously we focused really hard on our key informant interviews, and we really try to get a broad scope of stakeholders by interviewing people in academia, the private sector, nonprofits, and also government officials to get their perspective on the issue. And then we follow those up with more of a quantitative online survey that really supported us in our desk research as well. So we really looked at available public opinion polls, public health and economic impact studies, connecting air pollution to the situation in India right now, as well as we executed a market research campaign with a local agency in Delhi to really look at government and also commercial and industrial buyers of this technology to assist with our market analysis. But overall, we had some limitations. Obviously, we wish we could have been there on the ground with vulnerable groups experiencing the same pollution that they're experiencing to really embody that accompaniment approach. And we also had some issues getting connected with government officials just with the craziness of the COVID pandemic during that time. Next slide, please.
So what did we learn? So we found out that the problem of air pollution in India is really city-specific, and root causes depend on the city being considered. So tailoring solutions to the specific context is required, and this would mean working with a variety of stakeholders and a mix of solutions that may include an innovation like CAPS. However, demand for CAPS or any large-scale outdoor purifier at all will be hinged on a trial that shows visible, significant impact. Several interviewees we spoke to had doubts about the efficacy of such a technology. In addition, there seems to be other priorities competing for the attention of the government at this time, and we found this to include air quality, the need for air quality monitoring, aggressive monitoring, the need to capture pollutants at source, and water pollution. Now to the impact of COVID. India has taken a severe hit economically due to the COVID pandemic. So this is setting to define the agenda of the central government going forward. So CAP's success would be, in the near term, would depend on playing to this sentiment. And that's our presentation. Thank you for listening.
Thanks so much to both of the teams for that presentation. Let me ask a couple of questions before we move on to the other teams. First, let me start with PSEA. So international development takes place in many different sectors, as we know, such as health, education, and peace and stability. If you could tell us a little bit more, can the private sector engagement approach be effective throughout multiple sectors? Or is it only typical within economic growth and trade or in supply chains, for example?
Thank you so much, Melissa, for the question. This is a great question. And yes, we believe that the private sector engagement approach can be used effectively in all sectors. So based on our survey analysis, some sectors such as the ones you mentioned, economic growth and global health supply chains, are more exposed to working with the private sector than others. However, we believe that if development practitioners include the private sector in their planning process, in their stakeholder analysis, we have discovered that successful stories of when they do this, and they actually find creative ways and unique ways to gain support from the private sector. One key example that comes to mind is Peace and Stability Project that we're partnered up with JPV. JPV stands for Together for Violence Prevention Project in Mexico. The Chemonics partner worked alongside local actors to facilitate the replication of successful crime prevention models and best practices. And with this at its core, JPV actually used the local systems framework and conducted a survey to gauge the private sector's long-term economic losses that are attributable to violence and crime, and identified private sector partners that were already working in crime prevention. So JPV actually was able to contribute by offering technical expertise and bringing evidence-based approaches to amplify the impact of their violence prevention programs and improve the capacity of their partners. So this is a really good example that we actually will outline in a case study, and and we believe in short that private sector engagement may not fit in all projects, but we believe that all sectors can benefit from these thought process and the principles from private sector engagement.
Thanks so much, Lara. That was a great example, and I really appreciated the concrete nature, especially around peace and security. Moving over to our Corning team. If CAPS, the product initiated by Corning, isn't a solution to air pollution, what's the ideal mix of solutions to address this issue? And how does CAPS fit in, if at all, since you're working with this private sector partner?
Yeah, I'll take that one, Melissa. I know through our research, we really found that the ideal mix of solution achieves two things. And one is addressing the root causes or the sources of air pollution, and the other is controlling its impact on society. And in terms of mitigating the sources, that's obviously the sustainable long-term change and solutions that we're really looking for. And that's going back to the things we mentioned in our presentation, like better regulation, stricter enforcement. That also means resourcing the agencies that the government has created to combat air pollution so they can do their jobs effectively. And it also means providing alternatives to PM generating activities like alternative cooking fuel, alternative transportation, better public transportation, alternative farming techniques that mitigate crop burning, as well as investing in new technology like source capture. But as we mentioned, India's economy is one of the worst affected by the pandemic. And that's really going to be the attention in the short term, is going to be investing and pushing projects that help facilitate that economic recovery. So the thought process is that, these initiatives are going to fall to the wayside, at least in the short term. And that's why there really needs to be that cross-sectoral collaboration to really start generating more awareness and more public pressure to hold polluters as well as government officials accountable to addressing the root causes of this issue. But again, the second piece of that is controlling the impact, because people are prematurely dying and suffering today, right now, because of the effects of PM 2.5. And that's where CAPS fits in. It's helping to control those effects while the root causes are being addressed. And I know another aspect of this that we're looking at is, is this a sustainable market for Corning to enter? If the root causes eventually get addressed, where's the opportunity? And that's where we looked at things like the California wildfires right now out west. It could be an emergency response purifier. It could also be used at construction sites. Or in the future, it could be iterated to include pathogen sterilization, as well as possibly filtering out greenhouse gas emissions. So there's a variety of possibilities for it, but it definitely fits in more of a controlling the immediate impact as opposed to being a long-term sustainable solution.
Thanks so much, Tim. Really appreciate that. And I know the Corning folks are eagerly awaiting your report. I'm going to pass it over to Steve Reifenberg, who's going to introduce his teams.
Good morning, everyone. So if we've just heard the story of two organizations looking at the role of private sectors in kind of promoting development or thinking about major challenges like air pollution. The next two cases really look at organizations that are facilitating or interacting with the public sector around scaling educational issues and looking at health-related issues. And so our first team, which is working with the organization Insignia Chile, in Chile, Violeta, Josefina, and Sam, are exploring the question of how they might help Chilean local service organizations assist low-income schools in helping their children. flourish. And so Violeta, please.
Thank you, Professor Reifenberg. Good afternoon, everyone, and thank you for being here. Let me start by introducing our team. So my name is Violeta, and I've been working together with Sam and Josefina. Our partner organization is Enseño Chile, which is a non-government organization in Chile working in the sector of education. The goal of this organization is to address education inequalities that exist in Chile and to provide the government with the feedback on how to find the solutions to existing challenges in the sphere of education in the country. Next slide, please. So in our project, we tried to analyze the results of the reform of 2017, which was implemented in the country. As a result of this reform, more than 300 educational entities that existed in the municipality system were transformed in 70 public local educational services that serve as an intermediate agency between the Ministry of Education and schools. So right now we are working with one of the first local education service that was established in the country. This local service is located in the region of Araucanía, which can be characterized by high levels of poverty, high levels of rurality. It also has a high concentration of indigenous community, the Mapuche community, and students from this region usually perform lower on national test score, on national academic tests, than students from other regions of the country. So within this context, the goal of our project is to analyze how the local service of Araucanía can improve its management in order to promote better academic results of the students. Even though we are working with just one local service that is located in Araucanía, the idea of our project is that our deliverable and the results of the project will be used by other local educational services that have already been created and are still to be created. Next slide, please.
All right, so what we decided to do was form a framework, which is essentially a set of guidelines for how the local services personnel best oversee schools in Araucanía, with the hope that eventually this framework would be utilized in other regions of the country. So in order to best inform this framework, we decided to utilize as many stakeholders as possible, including parents, teachers, school leadership team members, and local services personnel. And to best do that, we originally, back in April and March, decided to have surveys, interviews, and focus groups that would be conducted in person in Araucanía. And at that time, we also had the primary focus being looking at the level of attention paid to rural schools by the local services, the community's perception of local services administration, and the uncertain context that came with switching from the municipality managed system to the local services managed system. Next slide, please. As a result of COVID-19, however, we had to pivot pretty hard with our instruments. Namely, we decided to implement surveys that utilized a number of resources, including WhatsApp online, phone, and paper-based surveys, as well as using interviews so that we could best get in touch with these stakeholders without having to actually go down to Araucanía. Next slide, please.
After implementing and analyzing the research instrument that Sam mentioned, we have come up with 4 core issues. First of all, given the particular context of the region, the local service in Costa Araucanía should tailor national policies to the specific requirements and strengths of these communities. Besides, even though the law establishes that local service should have enough autonomy to administer public schools, the national government closely oversees and monitors most of their activities. In fact, there is not much room left for autonomy. For that reason, it remains key to find innovative ways to enhance community participation when possible. For instance, the local service could establish feedback mechanisms through which community members can provide their input and exert accountability. As an example, as most of the parents use WhatsApp on a regular basis, using that platform to gather thoughts and opinions may be a useful way to foster their involvement in their children's education. What is more, given the high percentage of Mapuche students in Costa Araucanía, the local service should devote resources to engage and promote a genuine cultural debate, avoiding the folklorization of indigenous culture. It is key to promote administrative practices that are culturally responsible, locally rooted, and pluralistic in nature. Finally, stakeholders have mentioned that there is an opportunity to be more responsive. The local service should capture the best practice implemented under the former municipal system to promote more attentive procedures to the school's needs. With that in mind, we hope that these recommendations will help the local service in Costa Rica and later on to other local services to generate cycles of continuous improvement, foster collaborative associations within school communities, and promote an atmosphere in which everyone can flourish. Thank you very much.
Thank you, Josefina. That we want to move now from, and we'll ask a question in just a minute, but we want to move now from the education sector to a team that was looking at how do you scale major health systems improvement. And that team is Keough, Sultan, and Asaname. And they're asking the question of how might they go about creating large-scale improvements in surgical services in the South Pacific.
Welcome to the program on global surgery and social change. My name is Asaname, and with me is Keough and Sultan. The topic of our research is improving surgical services in South Pacific region. Our global partner is PGSSC at the Harvard Medical School. Next slide. Next slide. Surgical care is a public health priority because 5 billion people around the world lack access to surgical care. This problem disproportionately affects people in low and lower middle income countries, where 9 out of every 10 people cannot access basic surgical care. However, something happened in 2015. The United Nations transitioned to the Sustainable Development Goals, where Goal 3 alone has at least 8 targets related to surgery. In the same year, the Lancet Commission on Global Surgery released the publication Global Surgery 2030. The publication changed the paradigm in terms of understanding the unmet global needs of surgical care. One of their key recommendations was the development of national surgery, obstetric, and anesthesia plans, NSOP. The aim of the plan is to systematically gauge all the building blocks of the surgical health system, bringing together all relevant stakeholders and resources towards a common goal. The health ministers in South Pacific region met in August last year and agreed to adopt the recommendation to develop the surgical plans. This initiative is also supported by regional bodies, including the Royal Australasian College of Surgeons and the WHO Western Pacific Regional Office. Next is our response and anticipated impact.
So Sultan, we need to hear your voice.
So ILAB team has been working with PGSSC and government on developing NSOP for improving surgical care access. For this, we evaluated gaps and challenges in the surgical services. So main product of this work, NSOP, has been built on 6 domains: infrastructure, workforce, service delivery, financing, information management, and governance. So we measured each domain of NSOP based on different indicators. Like workforce were measured by surgical workforce density, like 20 surgical specialists per 100,000 population. So after completing situational analysis, we are now working on drafting the NSOP. We'll deliver it to the Ministry of Health, then they will implement it with the guidance of PGSC and regional international bodies. So now the impacts. So the main impact of this work will be the reduction of mortality and morbidity by increasing surgical care access. It will also help to create a healthy workforce and to promote economic growth. Besides, it will prepare the health system in the South Pacific region better equipped to face other health challenges like natural disasters and climate change. So next slide, please. Now the methodologies. So we had 2 collection methods. So first one is qualitative interviews of stakeholders and individuals involved in surgical care, such as physicians, nurses, midwives, and hospital directors. And the second method was quantitative hospital assessment, like how many surgeries are done each year in a hospital. So we directly conducted all interviews through Zoom and collected hospital assessment data by ministry assigned person. So location, so 4 Pacific countries, so Vanuatu, Fiji, Tonga, and Cook Islands. So next slide, please.
We found common themes in our data collection. The major issue across all countries is a lack of human resources, followed by problems in the supply chain. This is mainly due to the remote location. Nevertheless, there is great potential if coordination improves among regional partners such as the Royal Australasian College of Surgeons and the Government of New Zealand, who already provide substantial surgery support to these countries. In the countries where PGSSE had the strongest previous relations and where the governments are more invested, we have been able to make more progress, which highlights the importance of accompaniment in these processes. We also learned that taking first steps can generate a virtuous cycle. The WHO had its own regional plan regarding surgery, and it saw the development of the NSOPs as some sort of competition initially, but now they see it as the beginning of their own bigger plan. And finally, we found that working with governments involves a lot of complexity because it involves internal politics that we cannot understand very well, but in the end, it leads to great impact. If this initiative in particular has the potential to directly benefit the entire populations of our partner countries. Thank you very much.
Well, thank you very much to the Program on Global Surgery and Social Change team. Let me go back to our first team. Both of these presentations have signaled, the challenges associated with bringing the benefits, whether of education or health, to kind of lower income, more remote communities. Clearly, Enseña Chile, which was looking at a very remote community, a very low resource community, that would have been challenging if you were there. I'm wondering if you could just talk a little bit about some of the challenges you faced in terms of making connections to that community from halfway around the world. And what are some insights that you might draw from that experiences that might help move some of the policies you're proposing forward?
Right. So like you were saying, Steve, there is a very remote and rural nature in a lot of these communities in Araucanía, especially with some of these smaller schools that are essentially schoolhouse style schools where you have maybe 5 students and 1 teacher in the whole faculty student body, so to speak. And oftentimes, many of these people don't necessarily have internet capabilities, which made it very difficult for us doing our research in the United States, primarily relying on these internet capabilities. So specifically, we utilize paper-based and phone-based surveys to better garner information from them. And we had the help of an in-country facilitator who got us in contact with a lot of these schools that had connectivity issues. And while some of these schools did have internet connectivity, there was a lot of mobile data constraints associated with basically using your phone and not having the financial means to utilize data. Fortunately, in Chile, WhatsApp was able to be used for free across the whole country during COVID. So we were able to use that because of its popularity with everyone in the country to basically distribute surveys as well. And we feel that despite these numerous challenges, we were able to come away from this pandemic with a fairly comprehensive data set that at least we think will really contribute to our framework.
Great, thank you very much, Sam. I might just add, you mentioned the local in-country facilitator who just happened to be a former graduate of the master's program who had been in the iLab previously, worked with Enseña Chile, Sonia Urquidi, who's down there on a Fulbright. And so she, I know, was a great contact for you. Then the second question then for the Program on Global Surgery and Social Change. Both of these projects represent nonprofit organizations that are working with government to try and to think about innovating and scaling policies that are going to impact large communities. And so I wonder if you could talk a little bit about some of the challenges and some of the opportunities you see in partnering with government.
Thank you, Professor, for that question. So I think the most important advantage of working directly with government, if done right, is increased state ownership, which ultimately ensures sustainability. Because by engaging directly with government, you can get more insights into what they're already doing, their existing policies, and also how you can leverage and optimize these existing structures. And also, from our experience working in the South Pacific, we are able to, by working directly with government, we are able to align these surgical plans with the strategic health plans and also the government's vision. And by working directly with government also, it increases our chances of reaching the entire population. So the reach and the impact and reach of our projects or those strategic is going to be greater by working directly with government. And in terms of the challenges, of course, there's always challenges that comes with working with government. Hugo can shed some light on some of the challenges we are encountering currently working in South Pacific.
Yeah, definitely. Working with governments is a slower process than working with private entities, either businesses or non-profits. But in the end, it can yield to just bigger results. Like, as I said, one is the issue of sustainability. In terms of the health system, for example, it's only the government, the one that can ensure the sustainability of the health system in the long run, and it's also the only entity that can ensure universal access. So this is why it is very important. So even though it may be a longer process, but I think it is definitely worth it. This is where accompaniment is very important, because for us as a student consultant and PGSSC as a non-profit partner, it's about the accompaniment. It's about the government taking the lead, and we just support to achieve their goals. And if these are governments that care for their people, they want to do what is best for them, and then we just support that process. And I really believe this is the way that this approach should be.
So, well, thank you very much, the PGSSC team. So the role of working with governments, slower, more complex, but the opportunities for greater impact, for scale, and for sustainability. So I'm going to turn it over to my colleague, Tracy Keough, for the final two team presentations.
Great, thank you, Steve. And I am honored now to conclude with our final segment, Understanding Needs to Better Accompany Communities. Continuing on this theme of accompaniment, we'll hear from our Catholic Relief Services team and our second Chemonics team working on the series project. But CRS will get us started first. So Cara, Fiona, and Sophia, take it away.
Thank you so much, Tracy. Hi, everyone. My name is Sophia Pietzuk, and my teammates are Cara Vencian and Fiona Arbab. And we have been working with Catholic Relief Services for the past 8 months on this project called Home Beyond Walls. We were tasked to research how refugees and internally displaced people define and create home in both Uganda and Myanmar. This research responds to an $11 billion funding gap for disaster and conflict relief. Understanding what makes a shelter a home and a settlement a community could be a sustainable lens through which to promote self-recovery within disaster and conflict situations. Next slide, please.
In a world facing spiraling gaps in aid funding and fragile conditions, displaced persons experience a unique liminal status, often contending with complex questions of belonging and identity. Research shows that definitions of home are directly linked to these identities. Several scholars have studied this liminal status of refugees, whereby entire peoples do not feel belonging in any space because they have been uprooted from their sense of normalcy. In cases where governments of host countries, such as that of Uganda, when they oppose local integration and platforms to establish permanency for refugees and immigrants often seek an end to what is for them a perpetually liminal status by reconceptualizing the way that they perceive home and community. Primarily, the 4 dimensions of understanding home we have utilized in this project include the physical, emotional, psychological, and social. In these ways, refugees are able to reestablish a lost sense of grounding and reclaim their identity, building their capacity for self-recovery. Given a holistic understanding of home, directly provided by displaced people, practitioners like CRS can localize solutions in ways that transcend traditional material needs, leveraging the power of both local knowledge and recognizing refugee and community agency. Next slide, please.
After losing the ability to travel internationally, we implemented our Plan B, which had us employ 3 teams of local enumerators, translators, and transcribers in each of the countries, 2 in Uganda and 1 in Myanmar, and have us remotely manage them. We did all of our key informant interviews over Zoom, but the staff conducted the interviews, surveys, photography sessions, and focus groups in person. How that worked was we learned a software system called ComCare, which is a virtual data collection tool that could be installed on smartphones, and we trained our staff how to use these, often in the middle of our night. Our workdays were regularly 2 a.m. to 9 a.m. for Uganda and 9:30 p.m. to 6:30 a.m. for Myanmar. We were in constant communication with our staff for troubleshooting, using both Facebook Messenger and WhatsApp, and had daily meetings for recapping. In order to build relationships and show support to our teams, which is incredibly important for us, we were accessible via social media and had an event called the Debrief Dinner, where we could incorporate their own personal data discoveries into our data analysis. In the end, we were able to contact just as many people as we had planned in our in-person research, 416 people, with just as many data points, only minus the original activities we had planned that were dealing with in-person participatory mapping. The pictures you see are all pictures of either us and our team, or key pictures from the demonstrative photography exercise. We were very careful in conducting our research with the field staff, as we did not want to put anyone at risk for COVID-19, so we were sure to buy hand sanitizers and face masks for all of our staff, as well as provide face masks for any research participants. Next slide, please.
We recognize that there are 5 emerging themes in our analysis that are central to creating home. The first one is cultivation. Since most of the people that we interviewed came from rural communities and agriculture communities, this is a familiar activity that is one of their rituals, and so it is very much part of what they consider home. It is also a source of food, and it gives them a sense of responsibility and control in an environment where things feel very out of control. Also, the seasons and the predictable nature of growing food offers them stability. A second theme that emerged is the importance of family. Whether it's nuclear family or extended family, having family around creates a sense of well-being and makes a home really feel like a home. We also found that the structure of the house needs to mirror the family relationships. For example, having separate rooms for parents and children, or having separate structures for different members of the extended family. A third important theme was animals. These were not only an economic opportunity, but they also provided status to people depending on the different animals that they owned, and wealth, and also required care, much like cultivation, and this provided a sense of responsibility. The fourth emerging theme is economic opportunities. We found that people wanted to earn money, not just to earn money, but because they had a deep-seated need to provide for others. So that the economic opportunity was also tied to a social aspect. And the final emerging theme was the education for children and the importance of futurisms for them. So the desire to invest in children's education was not only so their kids could have a good future, but also because investing in their children meant investing in the community as well. So this is what we have for you. If you have any questions, feel free to post them in the Q&A box.
Thank you. And with this slide showing their teams around the globe, I will now transition over to our series team that worked with Chemonics. So Jacqueline, Eleanor, and Belen, we'd love to hear about your project next.
Thank you, Professor. Good afternoon, everyone. We are excited to be here with you, albeit virtually, to share with you a small glimpse into our lives this past year. My name is Jacqueline Biedronski, and my teammates Eleanor Jones and Belen Carriedo and I, in partnership with Chemonics and USAID's Resilient Waters program in South Africa, have been designing a tool set that promotes participatory decision-making in sustainable natural resource management. Next slide. Under the pressures of global climate change, communities around the world face an imminent challenge to develop effective decision-making strategies to manage the unique stressors on both their livelihoods and natural resources. Therefore, the problem we face is this: practical constraints on time and resources may not afford organizations the opportunity to engage participatory approaches that can help partnerships navigate the complexities of sustainable natural resource management within unique contexts. The 2 largest issues we aim to address within this problem are, first, communities and organizations, when attempting to address these challenges, must operate under resource constraints and also balance the interests and autonomy of a diverse range of stakeholders. Secondly, while there is a wide range of tools and activities that have been developed, there is currently no easy, manageable way to determine what tools would work best for their particular context. This is where our project comes in. Next slide.
Thanks, Jacqueline. The title of our project is Community and Environmental Resources, Ensuring Sustainability, or more fondly referred to as CERES. CERES is a comprehensive tool set giving communities access to the best practices in the field today regarding sustainable natural resource management. To do this, our tool set starts by using carefully crafted questions, which you can see in the top left corner there. These questions navigate communities and organizations in the development of self-identified community profiles. These profiles, taking into consideration contextual factors, feed into a systematically cataloged library of vetted activities. After the set of recommendations from the library of activities, the community and organization come up with their initiative design. In this component, we envision a negotiation stage that aids in the alignment between stakeholder agendas. Looking at the big picture, we aim to aid in the democratization of knowledge and participatory approaches so they can be more easily accessible by anyone with a shared vision. Keeping our partner in mind, who has dedicated ample time and resources to the actualization of this project, we hope to contribute to Chemonics's mission of a development-first approach by promoting participatory approaches co-designed by the community and building the capacity of its team to advance this mission in practice. Next slide, please. To effectively actualize CERES, we followed a four-part methodology. First, we did a desk review, which encompassed more than 90 different documents, including academic research and organizational reports. The desk review funneled through different toolkits and explored the variety of participatory approaches and activities that have been used and are currently being used. Next, we engaged 36 individuals with extensive rapport in working with communities and natural resource management initiatives. The objective of these interviews was to bridge the gap between the knowledge gained through the desk reviews and to understand the constraints faced by organizations in collaboration with the communities.
Our desk reviews and key informant interviews allowed the team to build the parts of the toolkit while allowing for our last two methodologies to serve as validation sessions for the toolset. Our first round of our validation process involved iterative learning sessions with key experts. These generative sessions allowed us to check on our biases and our assumptions grounded in CERES. To continue our validation process, we began to conduct virtual focus group discussions through WhatsApp chats with community members throughout the Resilient Waters partner Kruger to Canyons biosphere in South Africa. Next slide, please. Our process has allowed us to pinpoint two important findings. The first are the constraints that are present in predetermined and pre-funded projects. Many times, pre-funded and predetermined projects have goals and objectives that may or may not be aligned with the goals and objectives of different stakeholders. We implemented this finding into our toolset through the guidance of a scenario which acknowledges these constraints, which we call use case 2. We also noted that because of these constraints, negotiations are rarely undertaken between organizations and communities in realizing initiatives. It is only through these negotiations that we can retroactively challenge predetermined projects, goals, and objectives. Our toolset is currently building out a module to guide organizations and communities in the skills and activities necessary for initiative negotiation and continued negotiation in the ideation process. We have situated this module, what we have called Module 4, in the very last stage of our project ideation phase. We acknowledge our ambitious goals and the limitations of a year-long project, yet we are confident that our partners will be able to continue this project to realize its goals. Thank you.
All right, thank you, ladies. So now we'll open up for a little bit of discussion, and I wanted to start first with my CRS team. There were some beautiful images in your slide deck that I believe were derived from the demonstrative photography, which sounds like a really interesting method. Can you elaborate a little bit more about this methodology and how you used it in the research?
Sure. Thank you, Tracy. Yes, demonstrative photography is a tool that we developed. We had originally wanted our teams to have physical cameras and to go take our participants to go take pictures themselves. But unfortunately, we had to pivot that and have enumerators take guided pictures after the participants were given the prompt, what is important aspects of home for you, and they were directing towards different things like the structure of a house or some animals that are really important for livelihood, or even things like the inside of an altar, things that are very important to them and their specific aspects of home. We came up with this tool as part of a quest for some participatory analysis activities, and this one felt very personal, and it was a way to get questions to an answer that may not have been able to been answered verbally. So if you were to say, what means home to you? And someone was like, my father's chair, you would be confused. But a picture of a person's chair, and then we would have debrief questions afterwards about asking about those pictures. They would say, this is my father's chair where he would read me stories at night, or things like that. So we wanted to find a way to focus on those parts of home that aren't always in the forefront of our minds. And this seemed like a very appropriate way. And the results of the photography exercise were stunning, and we've seen some really deeply moving pictures. And so we are very excited that we were able to use this visual anthropology tool. Thank you.
Yeah, no, it's excellent, and it's a real way to provide rich context, right, to otherwise what can be, very generalized responses to something as complex as home. Sticking to this theme of context, I did want to pivot to my series team, because your work is anchored actually on that premise that context dictates everything, that each community has unique dynamics and needs driven by that context. What is it about the series approach that ensures that context, those specific needs, will truly be met?
That's an excellent question, Professor. First, at its core, series focuses on the ideation phase of a sustainable natural resource management initiative. So we have seen that truly participatory approaches try to involve stakeholders in many aspects of the initiative, but we have also noted that participation is lacking in the initial phase. And this is an essential phase to ensure community needs are truly met. Looking at the ideation phase, there are two essential aspects that make series contextually specific. They are the self-identified community profiles, where communities and their partners address the guiding questions. These questions are geared towards understanding the community's key characteristics that, through our research, have been identified as influencing factors in sustainable natural resource management. And the second is that the series framework is conducive for both the organization and the community to take a deep dive into the systems that are currently in place. We have 4 modules that aim to analyze many facets within a community. Module 1, for instance, looks at the people, their roles and connections within the community. Module 2 takes a dive into the systems, which allows series to explore future scenarios and uncertainties by performing systems analysis. Our 3rd module then identifies intervention options and arranges them in a provisional order for implementation. And finally, like we mentioned in our key findings, we have our 4th module, which involves negotiation. And in this stage, communities and organizations come together in a negotiation process where goals and objectives of a possible initiative can be agreed upon. Thank you.
Well, thank you so much, ladies, both teams. I'm gonna hand it over to Hannah because we have just a few minutes together, but I know our audience has some amazing questions queued up. So Hannah, would you like to guide us?
Thanks, Tracy, and thank you everybody for presenting. And we are a little limited on time, so I've asked our panelists to start answering some of the questions that you've put in the Q&A box. But for now, I am going to ask a couple volunteers to answer Peggy's question about these unexpected changes that have happened, including no on-site field work. And is there a factor you've learned that you would replicate in the future, regardless of the ability to travel? So if I could have 2 students maybe answer that question.
Yeah, this is Fiona. I'm happy to take a stab at that. Thank you, Peggy, for the question. The summer required a lot of self-reflective practice, which is very important as development practitioners for the future, as you might say. I came up just now with like maybe 3 insights that I will be carrying forward. The first being the importance of recognizing the trend in global development work of localization. And with localization comes with many possibilities, but also limitations as a foreigner. So I have a very personally complex identity as a first-generation immigrant, but holding an American passport, American citizenship, with that comes complex reflective practice and also recognizing how much more intentional thought must go into transnational relationships and partnerships that I, as a practitioner, will be committing myself to in the future. The second is the power of social media. I know there's been a lot of conversation, you know, the documentary on Netflix just came out, The Social Dilemma, and the strangeness and what's so scary about social media. But really, without social media, our project wouldn't have felt as authentic, I think. I was really afraid that because we wouldn't be able to travel in person, that our team wouldn't have as many of the authentic relationships, that the relationships would feel much more transactional. And I would hate for any of our projects to feel transactional and as if we're not contributing to transformative, you know, decolonial impact. But for example, something as simple as like having group chats on WhatsApp was essential not only for effective communication, say at 2 a.m. our time, which was 8 a.m. their time, but also we would send each other like funny photos and selfies and pictures of them eating and us making breakfast while they're having dinner. Like those things were really essential to relationship building and effective communication. Yeah, and the third is just having a really tight team dynamic. I think without my team, this very distant and virtual reality that we had to go through this summer would not have at all been possible, without the team dynamic that we have.
Great, thank you, Fiona.
And this is Tim. I'll jump in on that as well. I think the biggest benefit of this process has been the intentional reframing from taking something that could very easily be an excuse, like the COVID pandemic, and saying that I can't do this anymore, but intentionally choosing to look at it as an opportunity and the things that could be done and could still be accomplished, which was particularly challenging for this project because we really embodied the human-centered design aspect. And, you know, how do you keep that without ever physically being in a room with another human being? And I think it's not just the idea that, you know, I mean, a big piece was learning about the new technologies and utilizing them, but also utilizing them in a way that still embodies those same practices that we learned and developed from the human-centered design thinking, and keeping empathy at the center of everything and trying to still translate those virtually. And I think what it's done for me personally is, again, it kind of broke down those, what would have been seen as excuses to not do something, or excuses for inaction, to frame it as terms of opportunities to still see that same impact, but in a virtual capacities. And I think the theme from this whole pandemic, which, you know, we're still really enduring, is resiliency. And I think, I mean, everyone's saying that. I mean, our healthcare institutions need to be resilient. Supply chain resiliency is going to be important in the future. And I think that applies to the development sector as well. We need to learn how we can be more resilient in what we're doing and be able to still achieve impact and results despite the external circumstances.
Thank you, Tim. I'm going to turn it over to Steve for closing remarks.
Fantastic. Actually, those two final comments of Fiona and Tim really captured, I think, so much of, you know, kind of what we've been looking at over this last year. It's been a time of enormous challenge. Many of the teams signaled the challenges that they're facing and ways that they work to overcome those challenges. Another challenge is actually simply trying to condense in 5 minutes all the work they've been doing over this whole year. Mark Twain has this wonderful quote. He says, "If you want me to give a 2-hour presentation, I'm ready right now. If you want a 5-minute speech, it will take me 2 weeks to prepare." This was hard work to consolidate this in such a short time, but I think our teams did really a fantastic job, and want to congratulate all of them. And I want to end by just saying thanks. I want to say thanks first to the Keough School that supported every one of these students in the full, robust way they would have supported them if they went out to the field, and allowed them the space and the opportunity to have the kind of team experience that Fiona was talking about. So that without that support, we could never have done this. The second, we have a lot of partners that are on this call, which is just fantastic, but we could not have done it. And Tracy and Melissa and Hannah and I were amazed at the moment we figured we couldn't send these teams out to the field. And each one of those partners said, great, well, let's think about what's the work they can do that is still going to contribute to what we need to do. And so without that partner support, we would have never been able to do it. And finally, to the students themselves, just for this incredibly great work. We're really, really proud of you. I see our dean put a quote in this, or a comment in the quotes, in the comments. Maybe I'll just end with that. He said these presentations are uniformly impressive, eloquent, and instructive. Congrats to our gifted students and for their creativity in adjusting to the obstacles posed by the pandemic. So congratulations to all of you. Thank you everyone for joining. And with that, I think unless Tracy or Hannah, there's anything else, that we will close this presentation. Good job, team. And bye-bye.
Bye.